There we go. Let me just double check, make sure my mic is on, and there's audio, and we are good. Okay. How are you doing? Welcome to another Thursday Live here at the Association of PEMF Professionals. I'm Dr. Jerry Dreesen, Executive Director here at the AOPP. Apologize for that brief second there where we seem to have had a little microphone issue. So if you are jumping on here and you see something going wonky with the recording and the microphone, let me know. Today, I want to talk about our series that we have going on. This is our third in the series as far as making the science simple. And I thought with PEMF, as you know, it's a amazing product, and more and more people are using it. You're going to start seeing the science get more media coverage, so that's going to be good. And we have I'm just double checking here. Those of you that are watching live, I'm just double checking to make sure my sound is okay. Let me know if there's any problems with the sound. But we're going to talk about making the science simple, and today I want to talk about why are people using PEMF and how it affects chronic pain, how you can use PEMF to help people with chronic pain. So I thought I would lay out a few things, just a couple of slides to walk us through that. And again, if you are watching live, if you have any comments, just drop them in there and we'll take them as they go. So with that, let's start. And I'm going to shrink myself down here in the bottom corner. There we go. So let's talk about how PEMF is used to reduce pain at the cellular level. And this will probably be as scientifically geeky as we have. Joanne, hi Joanne. I'm just checking to see if my microphone's working here. Let me just double check one more time here. Yeah, looks like we got it. Okay, good. All right, here we go. So let's go to the next slide. So basically, in essence, PEMF acts like a gentle nudge to cells, and it rebalances their environment, calming down the process that amplifies pain. It's non-invasive, and it works without directly altering brain chemistry, making it distinct from many pharmaceutical approaches. So I think that phrase in and of itself really puts into perspective what PEMF does. It's non-invasive, and it works without directly altering brain chemistry, which is what a lot of pain medications do, because it nudges the cells and it rebalances their environment. So if you want to take this one phrase and write it down and use it as a quote to tell other people about it, I think that it's probably one of the best quotes or phrases about PEMF that I've seen in a long time. So let's talk about chronic pain and the things that are treated with PEMF. So arthritis, joint pain, fibromyalgia, muscle pain, neuropathy, that's where we have pain jumping down into our extremities, or it's more like a sciatica. And then, of course, chronic back pain. Those are probably the top four that we see a lot of. And We have tons of other things that going on. Hey, Maureen, thank you for that. And with these events, you're going to know, those of you that are using PEMF, that everybody's different. Even though we all have 206 bones, for the most part, some people have extra bone. Our joints are all basically the same. Our muscles are all basically the same. There are some variations, but our chemistries are all the same. I mean, the human body has not changed in hundreds and hundreds of years. We're basically the same. And so the things that worked on the body, thousands of years ago, work on them today. Although our bodies today have a lot more harmful things inside them as a result of our environment. So we have more environmental damages going on. And that's the things that are around us, but also the things we put in our bodies too. So some people have problems because of the foods that they eat. So if they're, all they eat is, junk from the store, there is problems with how effective PEMF can be based on that. Oh, I want to say hi to a couple of people. Hi, Beth. Glad to have you with us. We've got Joanne with us too. We've got Maureen. So welcome for those of you that are watching live. Glad to have you here. And yeah, feel free to drop in any questions that you have along the way. But these are the key elements of things that we need to treat or do sessions on. Hydration is a key component for PEMF as far as it working properly. So anytime you're going to be using PEMF on somebody, you don't know how hydrated they are or dehydrated they are. That's going to have a major factor on what's going on. And I've got a couple other things to talk about here in a minute on those aspects. Another thing as far as using PEMF is, what kind of scientific studies are out there, and just doing a simple search. There is, 4 that popped up. Randomized double-blind placebo-controlled clinical trial using low-frequency magnetic field in the treatment of musculoskeletal chronic pain. And there's the link. So again, randomized double-blind placebo-controlled clinical trial. That is the gold standard of research. Anytime you can read anything that has that listed as to how they got their information, those are the ones that you want to keep and you want to quote. Number 2 is just a systematic review. So some people will actually go into what's being printed out there and then review that and then give you their review of the review. And sometimes that's good. It's condensers. Instead of seeing the movie, you get to listen to somebody's summary of it. And that's what's nice about that. Or I guess this would be somebody sees a whole bunch of movies. So it would be like a genre. Like somebody watched all of the Lord of the Ring movies and they gave you a summary on them. That's what this is about. Next one is systematic review. Again, it is this is for low back pain. The other one is for musculoskeletal pain. Effects on stiffness, physical function, and quality of life in patients with osteoarthritis. So here's some ones you can look at. I put them in bold. You can check them out. I guess I'm blocking one of them, so let me change that out again. I'll just drop this in today's Facebook so that way you have them. Oh, there we go. That's a better way of looking at it. I want to shout out and say hi to Leslie. Hi. Welcome to the show. Glad to have you here. And again, there's more articles that are out there. You can do the search, and 15, 20 years ago, there was hardly anything out there, and you had to make sure that it was real versus somebody's opinion. And now you've got these great places doing these research articles. And then the next thing I want to talk about is benefits beyond pain reduction. And what I mean by that is, there's additional perks to using PEMF, and some of you have seen it. There's improved sleep, enhancing circulation. There is better joint mobility for pain sufferers. And these in and of themselves are healing for chronic conditions too. Well, hi, Janet. Welcome. Thank you for joining us today. So people who have chronic pain, oftentimes they don't get deep sleep, and they need that deep sleep to heal. They are not getting the proper circulation that they need, and so things are tight. And all of the better the circulation, like with a deep tissue massage, allows people that are just, you see them, they wear their shoulders like earrings. They're just like jammed up and they're so stressed out. They live in they're swimming in cortisol. They're so stressed out. Their whole world is stressful. And that's not good, because you start swimming around in that cortisol soup. Your body's going to start shutting down as the older you get. So again, this helps them out with that too. And again, better joint mobility. Some people, if they can just walk on their leg and move their knee more, they'll get out and do more walking. But right now it's painful and they can't step on it. What I'll do with a lot of those people that are having problems walking is I'll get them in a pool. I said, well, at least get in a pool so you're floating and you can put pressure on and move your legs around and it doesn't hurt and you don't have to worry about falling. If I can do that, at least get them to move that joint around, then we can start the healing process. Then they can start putting more of their weight on it, and we can begin to get that area to heal using PEMF, getting in there, helping with circulation, helping nudge their cells gently to heal. Pulling from an earlier quote here. And then next we've got PEMF versus conventional pain management. And those are some of the things that, people are talking about, like, well, what else is out there? Well, currently, or, the other side of it is drugs, as far as, things that you swallow, injections, and physical therapy, moving things around where, you're stretching and injecting, what we call the pill, puncture, potion, and powder way of health. And some of these things are pretty toxic. Some of these things do help out, but if you can eliminate not only inflammation, but the cause of the inflammation, then the person or animal can heal at a faster rate and it's more permanent. If you shut off that connection between the pain and the brain, there's never any healing. The person, and I tell people, well, if you're driving your car down the road 65 miles an hour and a red light comes on and says you need to change your oil right now, and you just take some duct tape and you put it over that red signal and you keep driving the car, that's not good. And some medications are that way. If they shut down that signal that there's a problem and you override that, same thing with animals. If you give them an injection of some sort of a pain medication, they're going to get up and move around, but that problem still exists. So again, if you can do whatever is available to decrease the inflammation and the cause of the inflammation, that's when you can really help people out with these problems. Some treatment protocols for chronic pain. We go into, those of you that are certified, that have gone through our programs and have the AOPP certification, know that we have things like session length, the frequencies, those of you that have the ability to change the different frequencies on your machines, and then how you can integrate PEMF into their pain management routines. That's where you would actually be able to go in and work with a vet or a chiropractor or massage therapist or osteopath, where you are part of the protocol of stations where they can go in and be a part of that, or come in and see you for 20 minutes before they go to their next, healthcare provider visit. So integrating PEMF in. Sometimes it's really good to integrate that after a session, because sometimes physical therapy will cause swelling, or chiropractic adjustment will cause inflammation. Same thing, osteopaths, naturopaths, or just even post-surgery. So there's lots of ways that you can integrate treatment or session protocols for chronic pain. And then some real world examples or testimonials of how PEMF has helped chronic pain sufferers. So if you are working with people right now and they have that pre and post, what we call the aha moment, write those down, have them write them down, get your Google business profile up and running and have them leave you a 5-star review for your business. That's what it's there for. It's for other people to see how you're able to help them out, to showcase their issues. I've had people they're coming in just for low back for their problems. And again, they use it, they stand up and they go, what is this again? Because I have them try it out. You should try this for your low back. And they've, as you know, those of you that use this, people have never experienced this before. Some people go, oh yeah, I've had that before. A doctor hooked me up on that. And I'll say, well, did they stick the pads right on your skin? Oh yeah, I think so. Or did they put goop on you and rub a machine on you to do stuff? They go, yeah, this is that. I mean, you number one, you don't have to take off your clothes. You don't have to stick anything on you. You can wear what you've got, and it goes through your clothing, and it's just as you explain this stuff, they're going, now what is this again? And then they'll use it, and they're truly amazed. But again, getting testimonials, that's all part of it too. Now shoulders, I mean, I use this on my shoulders. Those are the things that I damaged back in high school, old football injuries. I didn't have full range of motion in my shoulders. And when I got my machine, the first thing I did is I put it on all my old injuries from high school and college. And I used this quite a lot. And it went in there and took care of all my problems. My range of motion came back. My pain went away. So I thought, well, if it doesn't work on me, how can I tell anybody it's going to work on them? So that was part of it too. And as I learned more about it and studied it, then become a lot better at what's going on, but also helping other people as far as figuring stuff out, like which pad to use, how long should you be doing a session and stuff like that. Last one I have here, abdominal tear. I had a patient come in and she coughed and sneezed so hard this season that she tore an abdominal muscle, and she's like going on vacation. She goes, I can't have this thing bother me. And I said, well, I've got this PEMF device. And she goes, what is this? And I told her about it. She goes, yeah, let's try it out. And so she put it on her abdominal muscle, but I had her sit on a large pad behind her just to work on her back too. And she was in there for, I think we did 2 weeks. She was coming in 3 times a week, and she's doing 20 minutes. By the time we were done with their last session, she was able to go. And her abdominal pain didn't bother at all. And her back, she goes, and I don't even feel my back anymore. She goes, because we've been working on her back too. And she's done really well with that. So just had a total shoulder replacement, way ahead of recovery using my Rewarding Waves PEMF LLC. And yeah, it's crazy. And those of you that have watched previous episodes, I had a patient broke her shoulder, had a chip fracture or an avulsion fracture, had her arm in a sling, and we actually healed it 4 weeks faster. And it's still amazing that the doctor didn't do a double take. He's like, yeah, you're doing better. He's like, this is really weird. You're doing better. And she's trying to explain to him why. But it was like, okay, thanks, next. It's like getting him through the mail. She kind of felt like she was ignored what was going on. But very, very appreciative. She's a professional piano player, so she got to get back to work 4 weeks earlier than having to shut down. She's a teacher at a college, so she didn't have to put her career and her business and her teaching on hold. So you get to change the lives of people with this product using PEMF. Next, we talk about safety and side effects of PEMF for pain. So again, to know the good and the bad, but when you're talking to people, addressing non-invasive, nature, the minimal risks and considerations for use, but those are the good things. But the medications and implants, those are electronic devices. Those are the things that you need to go in and work with people and let them know about this. I've had to say no to a few people because of where their injury was and where their implant was. They're right next to each other. It's like, I don't want to run the risk. I've got a left shoulder injury. Oh, by the way, I have a pacemaker. I was like, I'm sorry, but we cannot risk shutting that pacemaker off, right? So just be careful of that. And that's why we want people to be certified, because somebody who buys a machine is like, oh, this is great. Hey, and then Mr. Johnson comes in, I had a shoulder problem. Okay, here, let me put it on your shoulder. Red flag. You didn't do the protocol of asking people, what's working, what isn't working. So again, knowing your devices, knowing the side effects, knowing the protocols as far as what to ask for. And then, of course, the future of PEMF and pain management. And we're going to find that there are emerging trends going on. There's ongoing research and its potential as a mainstream chronic pain solution. That's going to happen. I truly believe that what we're using right now is going to be the aspirin of the future, right? And the fact that it's non-invasive. And I believe that it's so far in the professions now that it can't be ignored. People are going to want to know more information, but again, the information's there, the studies are there, the case studies are there, the people like you are out there using it, getting before and afters, people leaving reviews on your website or your Google Business profile. It's all there. And now, which is nice, because as people are trying to figure out more, like, well, what is this all about? When they start doing searches, they're going to find you. They're going to find this information. It's there waiting for them to tap into. So you guys have done a great job promoting yourselves and promoting PEMF, promoting us to help do the certification and education so that people walk out with their machines having confidence and knowledge on what to do and how to do it. So it's a very good relationship that we have. And I want to thank you very much for letting us be a part of that. And so that takes us down the line of our 3-part series on making science simple. And this concludes why people are using PEMF as far as chronic pain. Hopefully you got to pull a few things off of today's talk. And again, some things that you can do to help spread the word of PEMF and how it's helping people out, and to help boost your business as well, is to let us know about you. Like and share, comment on what we've got going on. So as other people look at and find these threads, they'll see your comment and they go, oh, there's a person that's doing it. And they're right, in my area. So use us as a way of promoting yourself by dropping in comments too. Again, we have a blog. You can drop in there, grab information. We've got research on our website. Go to Facebook and like it. Go to our Instagram and like it. Go to our LinkedIn and like it. Go to our YouTube and like it. I am broadcasting this session live on all 3 of the Facebook, YouTube, and LinkedIn. So if you can jump out there and like it, that helps our algorithms. Again, we have a members only side. This is, I'm not able to do a live broadcasting to our members only because of how Facebook has it set up. Otherwise, I would be doing it there as well. So, but that's fine. We get a chance to jump out into the larger group. Those of you that are not members, you get a chance to see what we're all about and what we get to do on the inside channels too. Again, our code of ethics, what we're all about. This is our Pledge of Allegiance at AOPP here. But again, we want to grab all the stuff that's real, all the stuff that's out there, and present it to you, and also to provide the best education for humans, for animals, for small animals. Um, and those are some things. Oh, I was just taking a look at Elizabeth. As far as doing a Zoom, yeah, those are some things that we want to be able to do in the future. Is kind of have a live one-on-one with Zoom and have a Zoom group. But Zoom at this point, to my knowledge, doesn't do like a live broadcast over on the channel. But I'll take a look. This was a couple months ago. But thank you for that, Elizabeth. And again, I want to really thank you. I mean, here we are. We're winding down February. We're going into the rest of the year. Some of you are thawing out. Some of you are getting rain and mud. There's a lot of stress going on out there as far as having to deal with the weather and stuff. And one of the great things about PEMF is a really good de-stressor. So those of you that have a machine, use it on yourself. Get your shoulders and your upper back, get those things relaxed, get some of that cortisone out of there, refresh your muscles. Your animals will love it too. Hold the cat on your lap while you're using it. Your cat will love it. I think that will do it for me today. But again, thanks again. And we'll be starting a new series here coming up next week. Be sure to check your areas where we broadcast so you can see what's hopping up there. And I'll see you again next week. Thanks again. And thanks for everybody that's jumped in here and said hi to me. I really appreciate that. Take care.